I'm Carol Clifford. I'm an audiologist with Albuquerque Hearing and Balance. I'm the owner of this private practice, and I've been in practice for over 30 years. I'm here today to talk to you about what an audiologist does, how we're trained, and the different roles audiologists play in practice day to day. Regardless of the practice environment that an audiologist finally finds themselves in, we all start out with the same basic training and the same fundamental skills. Audiologists are, I guess, at the heart of it, diagnosticians. We diagnose hearing and balance issues. We do audiologic testing. We run tympanograms, impedance testing, acoustic reflex testing, otoacoustic emissions. Many of us also do auditory brainstem evaluations, vestibular evaluations, electrocochleography, electrophysiologic testing such as auditory brainstem evoked response, somatosensory evoked response, VEMP testing. Many of us also dispense hearing aids. That can be the evaluation of hearing aids, counseling a patient on what type of amplification may be best for their hearing loss in their lifestyle. It may also include fitting them with hearing aids, testing them post-fitting with measures such as real ear measurement and visual speech mapping, counseling the patient and their family on the best use and care of their hearing devices. In the educational setting, it might include following up with teachers and other people that interact with the students on how to get the most out of their amplification in the classroom. Audiologists in a variety of settings also work with FM systems, both in the classroom and for adults. FM systems being assistive devices that help the patient hear better in extremely challenging environments. As I mentioned, assistive devices are important in the big scheme of how a patient may do with a hearing aid, whether they're an adult or a child. So devices such as FM systems, which I've talked about, Bluetooth devices, which allow a patient to wirelessly stream from their phone to their hearing devices or their TV to their hearing devices, to telecoils, which allow patients to hear in public venues as if a speaker was right next to their ear. So assistive listening devices are a key part of what an audiologist may do in different practice environments to help patients hear their best. Medical issues are also an important area where audiologists need to be current and well educated. Health issues that can work in conjunction with hearing loss are important for audiologists to be knowledgeable about and to be able to help their patient. Audiologists frequently work with implants in a variety of different ways. Audiologists work side by side frequently with surgeons who may be performing a cochlear implant or a bone-anchored implant. And the audiologist will be helping the patient and the surgeon make good choices about what implants, the mapping afterwards. Or in different environments, you may be supporting that implant, such as an educational audiologist might support services in the schools regarding the implant, educating, again, teachers, school officials, people that might be involved with this child, understanding the benefits and the limitations of what the implant can be. Audiologists oftentimes will work as part of a team, either in the schools, with supporting IEPs and 504 documentation for kids who have hearing loss and need support through their education. They might also work as part of a medical home or a medical team working with ear, nose, and throat surgeons, with speech pathologists, with physical therapists, perhaps if vestibular rehab's involved. So audiologists can frequently work with other medical professionals to really help the whole quality of life issue for a patient. Audiologists are also frequently involved in what we call oral rehabilitation, and we're trained in that. And oral rehabilitation can be sitting knee to knee with the patient, helping them understand about self-advocacy, an adult perhaps with a newly diagnosed hearing loss who needs to teach coworkers or family about best communication styles and what they need to be able to hear well. It can also involve working with parents or children with hearing loss, helping them educate those in their community, maybe their church community, maybe their education community, maybe their family, about what this child needs to perform best in different environments. The other thing audiologists are frequently trained for, which can be useful depending on what environment you go into, is the business aspects of being a healthcare provider. Anything from working with insurance carriers to billing, appropriate insurance coding, and the business of running a practice, managing staff, human resource issues, budgeting, marketing, all of those areas that really aren't so much related to being a diagnostician, but they are related to running a business. And this can be needed even in an educational environment where you may be responsible for a budget for your department, or a university type of an environment, or research. Audiologists, as you can see from what I've talked about, frequently work in lots of different environments. And there's probably over 15 different environments. And you can work as an owner in a private practice. You could also work as a staff audiologist. I've also worked for a hearing aid manufacturer in their training and education department and their professional development departments. I've worked at several universities, both in a clinical role, working side by side with ear, nose, and throat physicians, to training students, to teaching courses. Audiologists can work in a hospital that may or may not be attached to a university. They can work in an implant center that just solely works with cochlear implant and bone-anchored implant patients. An audiologist might also work as an industrial audiologist, testing people in work environments and providing recommendations for sound level in that environment, noise exposure, and hearing protection. Audiologists also work in educational settings. In school districts, primarily is the place we think of, working to support a school district with day-to-day monitoring of children's hearing aids, their cochlear implants, their bone-anchored implants, as well as testing children of all ages, preschoolers through high school, and following these children throughout their educational process, supporting them in IEPs, in classroom needs, in resources, anything that might help this child be successful on as they transition from elementary to middle school to high school and beyond. We also work in vestibular labs doing testing for people with balance disorders, as well as rehabilitation, and working side by side with physical therapists or directly with patients in helping rehabilitate their dizziness. Audiologists can also be found working in retail environments, dispensing hearing aids for maybe a corporate-owned entity that has practices throughout a state or across the country, or for a large corporation that may have multiple locations nationwide, primarily testing for the purposes of amplification only. Audiologists work with various types of amplification to improve patients' hearing, and the variety of amplification has changed greatly. Traditional hearing aids are much more effective than they ever have been in the past, and patient satisfaction is very high. So one of the amplification options that's newer to the market is a concept of a PSAP, or a personal sound amplifier. This is a sort of an entry type of a device that may allow part of the community to explore amplification that might not have explored it otherwise, perhaps due to cost or uncertainty about the benefit of amplification. And the advantage to the PSAP is it is a lower cost type of an amplification model. Patients can begin to explore whether hearing devices are of benefit to them, which may lead them to do something more specific, more finely tuned to their hearing down the road. So the advantage is that it introduces more people to the benefits of better hearing at what we hope will be an earlier point in time, and not wait longer and see more of an impact of cognitive decline by not hearing well. Audiologists also frequently work side by side with ear, nose, and throat physicians, either as staff in an ENT clinic or perhaps as a co-owner, working side by side, testing patients as they see the ear, nose, and throat doctor, and providing follow-up services, including amplification. A key role that audiologists are trained in is to participate in part of the newborn hearing screening that's mandated nationwide. It's important that if a child has a hearing loss, that be identified as early as possible in life, and rehabilitation and treatment to begin early. That includes amplification, as well as speech and language services, as well as support for the family, helping them find the interdisciplinary individuals that will participate in this child being successful in language environments, in language learning, in education, as well as connecting parents with other medical professionals that may need to be involved in the broad diagnosis of this child's hearing condition, and also helping parents connect with other parents who have walked down the same road. It's key that audiologists are trained in this because they may have a lifelong relationship with a child that they diagnose early in life and follow all the way through to their college years and beyond. One of the other important roles that audiologists participate in is in hearing preservation or hearing protection, whether it be with working with a high school marching band to working with people in different walks of life, firefighters, pilots, different individuals that may be exposed to noise or may need custom pieces. Audiologists take impressions of people's ears and help people make good decisions about how best to protect their hearing or make them comfortable in their work environment.